So good evening, dear colleges. Today it's actually the last report in the last session, in the last section. So I'm lined about 45 minutes, but I will try to be a little bit conscious. I will try to be quicker. So my report is named Brain Metabolism Changes in case of impaired breathing or blood circulation in rodents, evaluated by real-time optical spectroscopy methods. So first I will briefly say about the team, introduce to the problem, discuss the materials and methods, results and discussion, and conclusion with some acknowledgements. So a few words about us. Our work is made in the collaboration of 3 universities. This is the R&D Center of Biomedical Photonics in Orel State University. This is the Department of Histology, Cytology and Embryology at Sechenov University in Moscow, and the Laboratory of Optoelectronics and Measurement Techniques Laboratory in University of Oulu, Finland. So the Orel State University is the dynamically developing education and science production center in the central part of Russia, and there are more than 2,000 students studying there. The research interests of the Center of Biomedical Photonics, where I'm working, is the development of biomedical optical non-invasive methods and devices for diagnostics such as dynamic laser scattering methods, fluorescence, diffusive fluorescence spectroscopy, and speckle contrast imaging. Sechenov University, full name is First Moscow State Medical University, is the oldest medical university in Russia and most of the CIS countries. It was founded in 1785 as the medical faculty of Первого Mosковского University, which is now Moscow State University, and it is named after Russian physiologist Ivan Sechenov. Currently there are more than 15,000 medical students in it. The department where I work too is the Department of Histology, Cytology and Embryology. It is also one of the oldest ones in Russia. It was founded at 1864. And the research interests include the translational research based on structural assessment of cells, tissues and organs functioning. So the main problem in intensive care units is the prediction of survival of the patients. And the prediction of survival of the patients directly depends on severity of the disease. So quite often the doctor predicts the ability for the patient to survive in the intensive care units due to the acuteness, due to severity in the disease. Basically, the brain death is caused by the impairment of breathing or the impairment of blood circulation. Both of these pathological statements tend to the oxygen deficiency, which causes the brain death itself. So simultaneously in the cerebral cortex, as one of the most sensitive to the oxygen deficiency tissue in our organism, occurs two processes: the oxygen saturation, which decreases, and the acute hypoxia, which grows. So the literature analysis show that the development of an acute hypoxic state leads to neurodystrophic processes in the cerebral cortex. In particular, decrease of number of neurons. On the other hand, the results of the authors analyzing the laser speckle contrast imaging show that dyscirculatory disorders during ischemia of cerebral cortex vessels leads to an increase in speckle contrast after subsequent reperfusion. Same results found by the authors led by Pьявченко. The authors noted a decrease in blood flow in ischemic areas. So for the real-time optical diagnostic methods which we apply in our Center of Biomedical Photonics, we use fluorescence spectroscopy, diffuse reflectance spectroscopy, and laser speckle contrast imaging. Well, we use it because fluorescence spectroscopy, it allows us to estimate, to evaluate changes in the concentration of coenzymes, such as FAD and NADH, which are involved in the regulation of brain cell metabolism. Diffuse reflectance spectroscopy allows to evaluate the oxidative processes status in the tissue. Meanwhile, the laser speckle contrast imaging helps to see the dynamics of changes in blood flow in large and small vessels. So the aim of our research was to compare metabolic activity and structural changes in the cerebral cortex after acute hypoxia caused by the impairment of respiration or blood circulation. So that will allow to approach to individualize the post-rehabilitation management of the patient with the acute respiratory and circulatory disorders in the intensive care units. To reach this aim, we formulated the following goals. We were interested to modulate acute statement of impairment for respiratory and cardiovascular CVS systems, to estimate metabolic activity of cerebral cortex tissue by the NADH and FAD coenzymes, to evaluate oxygen saturation in brain cerebral cortex by the oxy and deoxyhemoglobin, and to determine blood flow activity changes during respiratory and CVS disorders. As a golden standard histology, we took the brain and we assessed the structural postmortal changes in cortical morphology. We were interested to estimate the ischemia changes after the impairment of breathing or impairment of blood circulation. So the materials and methods. In this slide you will see the brief scheme of the design of the research. So the animals we took were the Vista rats, number of 6 in each experimental group. We took 2-month-old rats for fluorescence spectroscopy and diffuse reflectance spectroscopy analysis. Meanwhile, for the laser speckle contrast imaging, we took 2-week-old rats, Vista rats, male Vista rats. So the animals were fixed, and after the anesthesia, they were catheterized. They were catheterized and placed into the system for drug injection. Actually, we modulated the impairment of breathing and impairment of blood circulation by the administration of specific drugs which are causing these statements in the organism. So for fluorescence and diffuse reflectance spectra, we recorded 3 packs of data before the injection, and after administration of drugs, we recorded 20 minutes with the injection, after the injection, with 30 seconds break after each recording. After this, we made the mathematical processing of spectra. As for the laser speckle contrast imaging, we recorded 90 seconds before injection, administered the drugs, and then recorded for 20 minutes after injection, followed by the mathematical processing of speckle images. Few words about the environment. The environment was under the control conditions, with the temperature, humidity, and light cycle, with the exchange of the room air volume per hour. It was offered the standard balanced granulated nutrition for rodents as a feeding in accordance with the daily physiological needs, and distilled deionized water which was given to animals ad libitum. Health status was evaluated by the veterinarian that carried out daily inspection during 2-week quarantine period, and followed by the randomization with the body mass as the leading parameter, so that the mass values do not deviate from the average by more than 10%. So first, the animals were anesthetized with the Zolitil 100 drug, Vibrac France, in 0.3 milliliter per 2-month-old animal. As for the catheterization, we had a great choice of vessels to choose, actually. We had the jugular veins and arteries, we had femoral veins and arteries, it might be aorta, carotid artery, and many others. We chosen the right external jugular vein because anatomically and physiologically it is actually the best choice in our experiment. We were consulted by ecologists and we were advised to catheterize the right external jugular vein for better experiment realization. We took the PM60 polymer catheter produced by SPIE Russia with the external diameter of less than millimeter, so that allowed us to catheterize very small vessels of not only 2-month-old rats but also of 2 weeks old rats. So the catheterization was carried out under the heating table with a LED lamp, and we took the catheter with the heparin solutions and instruments for animal surgery, and after surgical field preparation and layered cut, we mastered the ligature, macrocision of the vessels, and inserted the catheter for then being withered, and we sewed the layer by layer, so then the animal had the catheter inserted into the jugular vein. Operational access to the skull bone was carried out by dissection of soft tissue for 2 weeks old rats for laser spectral contrast imaging method, because we wanted to do it without opening the skull. In case of laser fluorescence and diffuse reflection spectroscopy methods, we took 2-month-old rats. Their skull was quite strong, so we made the operational access to the brain cortex by drilling a window into the skull. So then we put the needle inside the specific area of the brain and recorded the data we were interested in. The identification of the structures of the brain was carried out by the Red Brain Stereotaxic Atlas by Pexens and Watson. We were mostly interested in the cortex. We took the data from mostly motor or sensory motor area of the cortex. We put the animals into house-built system with stereotaxic apparatus and recorded our data. This is the scheme which illustrates the fluorescence and diffuse reflection spectroscopy system which we recorded with the data. Here we can see the rat and there is the needle probe. Here it has a lot of channels in it, has the spectrometer, bare band source, and also the 2 wavelengths are possible to do with this needle probe. These are 365 nanometers and 450 nanometers. So the needle was inserted into the motor cortex of the brain of the rat. The output power and the excitation light flux, as well as the aperture information, is given on the slide. Let me not repeat this data. And so for the laser spectral contrast imaging, the standard special algorithm has been used for images obtaining. Every spectral contrast formula and the data we took is given in this slide. And for the breathing and blood circulation impairment models, we took specific drugs which were chosen by the recommendation after the analysis of the specific literature. So for the breathing impairment model, we took 0.3 milliliters of propofol, which were injected into the jugular vein by the catheter. And after this, it was followed by the non-depolarizing muscle relaxant, cistatracurium, in a little dose. This combination of the drugs immediately caused the spasm of the respiratory muscles and respiratory arrest. For the blood circulation impairment model, we took lidocaine 2% solution in a dose of 1 milliliter, injection of which immediately caused a cardiac arrest. After the data recording, the results were processed with the MATLAB software. For the spectral contrast, it was using a temporal algorithm for averaging over substacks, and for fluorescence and diffuse reflectance spectra, it was a special algorithm for this in the MATLAB software environment. Processing of the results was carried out by Origin Pro software. After this, we took the brain for the histological analysis. We fixed it in a buffered formalin and made the brain tissue sections, thick sections with the 5 micrometers thickness, stained by hematoxylin and eosin. We were interested in identification of signs of cortical hypoxia in it as a golden standard to confirm the data which we previously obtained by recording of the spectral and laser spectral parameters. In ethical conclusion, I would say that all the manipulations with animals and the experimental conditions were reviewed and approved by the ethics committee of Orel State University. Results and discussion. So in this video we have the recording of two brains. One is the brain right after injection of drugs, which are called the respiratory arrest on the left, and in the other case on the right for the heart arrest, just right after injection of the drug. I would like to play this video and we will see the differences which are happening. As we see, the blood flow in the brain, which belongs to the animal with the cardiac arrest modulated, occurs 2 times quicker, 2 times faster. On the other hand, the same process takes approximately 2 minutes in the brain tissue, brain vessels, large and small vessels of the rat that was modulated with the respiratory arrest. Moreover, we can say that the blood flow in the large vessels and on the left still remained much longer than in case of the brain tissue for the cardiac arrest. I will show this video once again. So we also studied the area of interest in the breath impairment case. These are the results which show the mean spectral contrast in time. This area of interest is the microcirculatory vessels, and these are the large vessels, especially this one point belongs to the venous sinus. So we can see that after the modulation of respiratory arrest, the mean spectral contrast increases in 50 seconds to 1 minute, and it is not so acute. It's quite moderate, I could say. In case of heart impairment case, we see huge differences in the same regions, approximately, in the microcirculation vessel area as well as in the venous sinus area. This growth of the mean spectral contrast in both cases was very, very expressed, and it happens much earlier. It happens between 50 and 60 seconds in both cases. As for the results of fluorescence and diffuse reflection spectroscopy, these are the intercalated spectra examples which we recorded before administration of the drugs which stop the heart and the breathing of the animal. So the processing of the results are illustrated in this slide. Here we can see how the data was analyzed for the fluorescence spectroscopy in a wavelengths of 365 and 450, for which illustrates the activity of NADH and FAD coenzymes. On the next part of the image, it shows the analysis of the diffuse reflection spectra for the wavelengths of 560 and 580, which corresponds to oxy and deoxyhemoglobin in the blood. So this one slide illustrates one of the cases which we faced with during the breath impairment. On the left side we see fluorescence spectroscopy data in time, and on the right side in the right part we see the diffuse reflection spectra of the same animal in time. We see that there is the slowly developed growth of the excitation of the intensity in the excitation of 365 nanometers, and the decrease of the intensity in the excitation of 450. On the right slide we can see that the most changes in the analysis of diffuse reflection spectra occurs in first 5 minutes. So the metabolic changes, the decrease of oxyhemoglobin occurs in 5 to 10 minutes, we can say so. The second slide illustrates practically the same picture. The small, poorly expressed growth of intensity in the excitation of 365 and the decrease in excitation of 450, while the DRS analysis shown the expression in first 10 minutes. For the heart impaired case, we saw different picture actually, because the growth of intensity in wavelengths of 365 and decrease of intensity in wavelengths of 450 nanometers was much more expressed, and it occurred in the first 5 minutes. While for the diffuse reflection spectra, growth we noted also in first 5 minutes. Practically the same image with some more changes, I'd rather say, we see on the second slide for second case of heart impair. The histological analysis of the brain tissue of the animals, brain cortex, from breathing impairment and blood circulation impairment groups shown that in the case of in all the cases of breathing impairment, we saw numeric hypoxic changes in the neuronal morphology and local perivascular edema in some places. Meanwhile, for the motor cortex sections after the blood circulation impairment, we saw huge amount of hyperchromic wrinkled neurons and pericellular edema, which was well expressed and in many places, as well as the glial nodules and microbiotic neurons. To summarize the data which we obtained, I would say that in acute respiratory failure, there is a gradual increase in hypoxic disorders and a slowdown of hemodynamic processes. All these processes are noted in the first 20 minutes of the start of recording, but are well expressed in first 10 minutes. In acute circulatory disorders, there is a sharp cessation of oxygenated blood supply to the brain cortex tissue, and it happens in the first 5 minutes approximately. So we can say that the acuteness of this process, it is 2 times quicker, actually. So to conclude, I would like to say that the blood circulation, the blood circulation in the vessels of the cerebral cortex stops in case of respiratory arrest after approximately 2 minutes, and when heart arrest occurs, it's about 1 minute. Cases in the brain tissue oxygen saturation under a heart arrest happen in the first 5 minutes, while an acute breathing impaired practically do not change it. Heart failure is characterized by more acute hypoxic disorders in the cerebral cortex in comparison with the processes that occur in the cortex when breathing is impaired. Acute cardiovascular failure is a more life-threatening process that causes a rapid increase in the neural metabolic deficit in comparison with acute respiratory diseases. These data which we obtain may be used to personalize the management of patients after acute respiratory disorders and respiratory arrest in the prognosis and rehabilitation in intensive care units. I would like to acknowledge the Russian Science Foundation for the support, as well as my colleagues. They acknowledge the grants from the Academy of Finland, which supported this research. I would like also acknowledge my colleague Dr. Konstantin Lapin from Institute of Cell Biologics of Russian Academy of Science for the guiding and useful discussion of catheterization methods. And mostly I would like acknowledge SPIE chapter and SPIE itself, because last year I was awarded with John Keel Scholarship, and that is the reason because why I'm here and why I'm reporting. This support allowed me to be present here to give this report and to share the information and the results of our research which we are working on with. I would like to thank also my colleges. We have a big team in the Center of Biomedical Photonics, and my collaborators. Without them, this complex and difficult research based on many various methods which we recorded simultaneously and analyzed together wouldn't be able to do. I would like to thank you for your attention, and I will be very happy to answer all your questions. Thank you very much.